Sleep apnea is about as common as diabetes. It's a real common disease, almost as common as asthma. We are pretty bad at diagnosing it. It's estimated that something like 15% of people with sleep apnea are being diagnosed with it, which is really not very good. I mean, if I were to say the same thing about diabetes, we'd think it's a public health problem, and it is a public health problem. Part of the reason for that is the treatment for sleep apnea, which is relatively difficult, involves sleeping with a stupid-looking mask at night. It's not the simplest thing in the world, and in fact, it's been only a little over 30 years that we've had any treatment for sleep apnea. Still a tremendous amount of ignorance about sleep apnea generally. It's also a somewhat difficult disease to treat, to diagnose perfectly. The main diagnostic features are sleepiness, which is really vague, and snoring, which is really common. So we don't have any perfect way of being able to simply say, okay, you have sleep apnea or you don't have sleep apnea. We treat sleep apnea for two separate reasons in many ways. We treat it because it makes you sleep better, it makes you less likely to be sleepy, it gets rid of the noise of snoring, and all those are good things. But there's also pretty good evidence, at least if sleep apnea is severe, that you live longer if you have it treated, to put it most bluntly. There are cardiac side effects. It has effects on blood pressure, it has effects on blood sugar for diabetics. There are many reasons to think that it's bad for you long term. Although not an emergency, in the long run it needs to be treated. Well, CPAP still is the mainstay. It's gotten incrementally better. It's evolved. The first machines that I can remember from 30 years ago were enormous, looked like big vacuum cleaners. Now they're fairly sleek, they're completely quiet, they're pretty dependable, and they do some very clever things. For a clinician, a big advance is they actually monitor your breathing while you're asleep now. For a long time they've monitored how long you use it. Now they'll actually monitor how well it's working, how much apnea you have, and that's a real plus. 30 years ago, I would tell patients, this is the best we got right now, talking about CPAP, but I'm sure we're going to have something better to replace it pretty soon. I don't really say that anymore because I'm not sure what's going to replace it. Other ways of treating sleep apnea include surgery, which is in some people great, but in most people not. A dental appliance, something you wear in your mouth at night, can help a great deal, particularly if it's fairly mild. And maybe the newest, most exciting stuff is the possibility of a real pacemaker to improve sleep apnea. This is an implantable device that by stimulating the nerves that open up your airway can improve sleep apnea enormously. Well, there's a pacemaker that looks very much like a cardiac pacemaker. It senses what's going on in breathing with a small wire that goes toward the rib cage, kind of around here, it's usually on this side, and another wire that stimulates the nerve that innervates the hypoglossal nerve, that innervates the tongue, back of the throat to open things up. It's a very clever idea. It's still very new. It is no longer experimental. It's available. But I'm not sure I'd predict the future as to what that really will be.